Hello, NICU team. It's Cassie with your Responder 5 nurse call update. So the question of the day is, what is this thing and what does it do and what do I do if it alerts me? This is your staff terminal. When nothing's happening, it's just a simple clock. But if I touch it, it turns into a bunch of buttons. These are all simple touchscreen buttons. So each of them sets off lights, alarms, or calls people. It might do all three of those things or only one of those things. The lactation consultant button calls the two lactation consultant phones, and they can press accept, which will stop the alert, talk, and they can talk to you through the speaker, or decline, but you can leave a message. The isolation button turns a yellow light on outside of the room to show people walking down the hall or people coming into the room. Yellow light means yellow gown, so put on your isolation gear. Be sure to read the signs outside of the room so you know if it's contact or droplet. High falls risk, which every patient in the NICU is, turns on a green light so everybody knows that this patient is a high falls risk. We don't need it on for every patient in the unit, but this is something that you need to be aware of when you float. So if I pressed high falls risk, you would see a red box around the button that I've pressed. A green light would come on outside of the room to show people, if this patient starts to get up or call for help, I need to respond quickly. To turn it off, I simply hit it again and the red outline goes away. Restricted visitors is another visual cue to show us if we see lots and lots of people going in and out of this room, maybe we should check on them because they have a restricted visitor status, meaning we don't want lots of people in and out of that room per parent or safety needs. The timer brings us to a second screen where I can set a timer to come to the phone that I'm carrying if I'm the nurse assigned to this room. I can set it for 15, 30, 45, or 60 minutes, and in 15, 30, 45, or 60 minutes, my phone would alert with this room number on it and tell me that my timer has up. Discharge orders written is something for our physician and provider partners to use. When they've come in here and talked to mom and done their final discharge teaching, if they press discharge orders, it will alert the nurse's phone that is assigned to this room so that nurse knows that I have orders, things I can print, and I can do my final teaching and streamline discharge from the hospital. EVS calls the EVS personnel assigned to your unit. So in this case, this would call the two EVS phones that are assigned to the NICU, and it would set off white and orange lights blinking outside of the room. Remember, lights mean something. If you see lights, respond. Orange and yellow means this room needs servicing for some reason. I would press this if my trash was overflowing, if I had a spill on the floor, or if I just needed an EVS touch-up. When EVS comes, they can stop this by pressing the button again and getting rid of the red square. The next button here is clean screen, pardon me. I'm going to show you this one at the end. So now I'll show you the emergency buttons. If I press the big red medical emergency button, it brings me to another screen of all emergencies. The one in the center is the one you're most likely to use in the NICU. This is neonatal emergency, and it calls all of your fellow NICU team members. It lets them know that you have a code. So it would call the RNs, MAs, RTs, and providers in the area. It would say Neo Emerge with the room number. Medical emergency calls the STAT team and the more traditional code team. So you would hit this if one of your fellow staff members or a parent was down and needed to be coded. Keep in mind, all emergency buttons set off lights, alarms, and alerts. So neo emergency, if you have a code and I press this, there's going to be pink lights blinking outside of the room, an emergency alarm will sound, and it will go to everybody's ASCOM on duty in the area. Medical emergency will have blue blinking, and it will go to everybody in the area, as well as the STAT team and the ED charge nurse. Missing child sets off orange lights above the door, and it calls 1028 Main Street, which is where our security officers are headquartered. They will answer the phone, and you will talk to them through this speaker to tell them you think your patient is missing. Obstetric emergency gets you your obstetric emergency team. It blinks pink lights outside of the door, and it calls everybody from the OBGYN team or the labor and delivery team to help you. The most common use of this button would be if somebody delivered a baby in the wrong spot. But in the NICU, if you had a mom postpartum who was bleeding or had some distress, you might want to use it as well. The RT button calls the respiratory therapist assigned to your area. What they would see is the RT call and the room number. Rapid response is our traditional rapid response call. It blinks red outside of the room, and it calls the rapid response team. Staff assist means I need help, so it doesn't get me any providers, but rather it gets me my friends in the area, my fellow nurses, MAs, and RTs. If I hit back or home, then it goes back to the original screen where I can show you what clean screen does. It gives you a 30-second timeout so this screen can be cleaned and wiped off without setting off any false alarms. The only other thing for you to really know about in this room is the stuff that's in the head walls. Sorry for the walking, but here you go. Over in the head wall, you have similar buttons. So you have Staff Assist, which gets you your MAs, RTs, and RNs in the area. not providers. And then NICU emergency, which is the same as the NICU emergency I just showed you on the touchscreen. It will create blinking pink lights above the door. It will call an emergency, so everybody in the area will come running to you as if it's a code. Staff assist sets off red blinking lights and gets you help. So this is I need hands, and this is a code. To silence either of these buttons, I have to go to the place of origin, so I'm going to silence it here. This, sorry about that, is the nurse call bell. So this is the button mom would push if she needed help with the baby. Maybe she's holding, maybe she's feeding, maybe she's kangarooing. If she presses this, it sets off white lights outside of the room, calls the MA, and then the RN. To silence any of these, you have to silence it at the point of origin. Aux port number 2 is where the nurse call bell is plugged in, so if somebody presses that red button, I have to silence it from here. If I press these buttons, I have to silence it here, and if I just use the touchscreen, I have to silence it there.